Bronson has engaged in a special program called Project Niche, Nurses Improving Care for Health System Elders.
Through the Niche program, I've seen evolution in our nurses who care for this patient population. Taking care of older adult patients is not an adrenaline rush, not anything you see on TV. And through the education and the expertise that these nurses have obtained through our program, our partnership with our community, these nurses take pride in the care that they provide these patients on a day-to-day basis, and that's really what I'm so proud of.
Well, Bronson's been participating with Niche now for over 10 years, and we're all extremely proud of the amount of work that's been done by our nurses on integrating best practice care here at Bronson. Actually, not only are they integrating it here at Bronson, but they're mentoring nationwide other hospitals to become Niche sites. So we're very, very proud of that.
What I have found over the last 10 years, the niche concept, niche program is integrated in everything we do every day, our charting, our protocols, and now it's part of the Bronson culture.
The goal of the National Niche Program is to provide acute care nurses with mentorship and resources that support excellence in patient and family-centered geriatric care.
I'd say they're doing just great. Each one is so personalized to me, and it tells me so much about myself. And I've become like friends to them, and I've enjoyed every one of them.
When I round on the unit and talk to patients, they're not talking to me about the tools that the nurses use to assess their fall risk or their skin condition. The patients talk to me about the connection that they feel with our nurses and our patient care assistants. And along with the tools, the nurses also learn how to communicate with people. And I think that's a special gift that we have here on this unit, is how we partner with our older adult patients and make them feel like they're part of our family here.
I enjoy the geriatric population, listening to their stories, getting to know the person behind the illness or the disease or the infection that brought them to the hospital, and being able to provide care and use the tools Niche has given me to make sure that their outcomes are reached.
Niche is a very important program. It's a very special program simply because it is based on research. It's not based on what nurses think they should do or what staff think might help a patient. It's really based on evidence.
Bronson Methodist Hospital cares for more than 7,600 older adult inpatients each year.
As a provider, I see a distinct difference in nurses who are trained in the Niche program. I note better patient care and a robust team approach that helps me deliver optimal care to every patient every time.
We have a wonderful education program here at Bronson. It has many components. First of all, it involves an 18-module self-study program that the nurses do on their own, and then they come to an 8-hour class.
We are very proud of the more than 40 Bronson nurses who are nationally certified as gerontological nurses. These nurses are leading the way to meet the specialized needs of older adults as an essential part of the care we provide.
The patient population is aging, and it's increasing in size, and it's going to really be beneficial for us, our co-workers, and the hospital to have this part of our practice.
In Kalamazoo County, there are currently about 30,000 persons who are age 65 or better. By 2030, this number will increase another 29%.
It's extremely important for Bronson to have a niche program because we know that the baby boomer population is aging. The fastest growing segment of the population is the 85+ group. And so these patients will be coming to the hospital, and we need to provide the evidence-based practice care that their complicated conditions present.
Well, looking to the future, Bronson remains committed to our older adult population. And we're going to continue to raise the bar to implement the very best practice in geriatric care at the bedside, across the Bronson system, and throughout the community.